Good morning, my name is Emma Akers and I'm a second year nursing student at ACU. I'm going to discuss in depth the chronic disease of emphysema, pathophysiology, pharmacology and possible nursing care plan. I'm using example scenario number 2 from the assessment information provided by ACU. I will now discuss the epidemiology of emphysema, which is essentially a type of chronic obstructive pulmonary disease, or COPD for short. COPD is an umbrella term that indicates emphysema. Emphysema is when the air sacs and membranes within the lungs, also known as alveoli, are progressively destroyed. Emphysema and COPD prevalence has remained steady over the last decade, from 2.4% in 2011 to 12 to 2.5% in 2022. Prevalence was similar between males and females in 2022. According to self-reported data in the Australian Bureau of Statistics National Health Survey, around 638 million people in Australia were estimated to be living with emphysema. The current trend of people living with COPD or emphysema is rising from the years of 2017 to 18 to the year of 2022, from 600,000 to approximately 650,000. COPD or emphysema was recorded as an underlying cause of death for 7,691 deaths per 100,000 of the population in Australia in 2022. Mortality occurs predominantly in males over the age of 85 years. The at-risk population are people over the age of 55 years who are male. Some of the main risk factors to developing emphysema or COPD are smoking tobacco, genetic factors such as having a protein disorder called alpha-1 antitrypsin deficiency, or AATD, lung growth and development factors, environmental factors such as working with asbestos, and other conditions such as asthma. COPD and emphysema are the fourth leading cause of death worldwide, approximately making up 5% of all global deaths. Emphysema is a preventable disease and treatable disease that can have clinical manifestations of breathlessness, chronic productive cough, dyspnea, wheezing, and fatigue. Emphysema happens when the lungs, trachea, bronchi, bronchioles, and alveoli are damaged and inflamed from repeated environmental exposure, such as cigarette smoke or other chemical irritants. Oxygen and carbon dioxide exchange happens within the lungs via capillaries, and when there is repeated exposure to harmful stimuli, such as cigarette smoke, these capillaries release an inflammation response in the form of increased neutrophils, macrophages, and lymphocytes, and they fill up with mucus exudate. Low oxygen levels start to appear because airflow is impaired due to irritation, inflammation, and vasoconstriction, or narrowing of the bronchiole. Vascular hypertrophy appears as well because the cells within these capillaries are remodeled. Because there is impaired flow through, air trapping, and gas exchange abnormalities through the bronchiole, the alveoli are damaged, which ends in emphysema and some clinical manifestations such as coughing, dyspnea, and hypoxemia. One medication that could be used to treat emphysema is salmeterol, which is an inhaler. Salmeterol falls under the drug class of a long-acting beta-2 agonist, or LABA. This specific medication relaxes the smooth muscles within the airways, prevents bronchospasms and constriction of the smooth muscles. The mechanism of action of salmeterol happens within the lungs and involves the interaction of the side chain of the molecule with an auxiliary exocyte, which is a domain of highly hydrophobic amino acids within the fourth domain of the B2AR. Binding to the exosite prevents dissociation of salmeterol from the B2AR and allows the active salginin head to repeatedly engage the active site of the drug. This makes salmeterol long-acting, up to 12 hours, but has a short onset of action of 30 minutes. Salmeterol is indicated for use for asthma, bronchospasms, COPD, and emphysema. Some nursing considerations that should be thought of are monitoring respiratory status, ensuring the patient has a good technique when using this medication, evaluating the effectiveness post-administration, and monitoring for potential risks and side effects such as tachycardia. Within the nursing care plan are things that the patient needs to look out for that could land them in the emergency department. This includes an acute exacerbation of their emphysema. An emphysema or COPD exacerbation includes increased dyspnea, changes in a cough, and changes in sputum that is produced. Once the patient is in the hospital, depending on how acutely ill they are, the nurse will attend to vitals, gather any abnormalities with the patient, document and report to the doctors in charge looking after that patient. The infographic template has been used to identify the acute issue, which is increased dyspnea. The lung function and respiratory system is impaired, and the lungs are having trouble maintaining homeostasis, and also gas exchange is impaired. Goals for issue 1 is to decrease patients' exacerbation of dyspnea. Perform regular vitals and respiratory assessment, and aim to have this done within 1 hour of the patient arriving to the emergency department. Interventions for issue 1 is administering a short-acting bronchodilator inhaler, oxygen therapy, and antibiotics if there are signs of infection, such as fever and changes in sputum color. Justification for the interventions have been outlined in the nursing care plan are that the patient has the nursing diagnosis of impaired gas exchange, which is leading to increased dyspnea. The patient needs help with opening and relaxing the airway more to maintain a stable oxygen level. People with impaired gas exchange have trouble maintaining homeostasis within the lungs, and lung function is dysregulated. Mucus exudate builds up in the capillaries, and low oxygen levels appear because of vasoconstriction and inflammation of the airways. The patient may also not be able to follow their medication plan at home of their emphysema, which is now progressing and may lead to an acute exacerbation of dyspnea and impaired gas exchange. The interventions that have been prioritized are close monitoring, regular vital observations including respiratory assessment, and possibly administering medications if the doctor orders them, such as a short-acting bronchodilator, oxygen therapy, and antibiotics if there is an infection. Some extra interventions may include reviewing doctor progress notes and orders to further provide nursing care based off what the doctor orders.